Hi, my name is Dr. Kristen Hick. I'm a licensed clinical psychologist and founder of Center for Shared Insight, a private practice specializing in individual relationship issues. Today I'm going to be speaking to you about an important issue, how to choose a therapist that's right for you. This is an important issue because not every therapist is the best fit for every client. And so you want to take a little time to research this and get to know your therapist before really deciding to commit to the process. The first of 5 characteristics I'll talk to you about today is your gut feeling. This, I think, is the most important of all the 5 characteristics in helping you choose the therapist that is right for you. So this is just a feeling you get in your gut of whether you feel like this person understands you, that they'll be able to help you, that you feel comfortable with them. And if you don't feel this gut feeling within the first session or 2, perhaps maybe even the 3rd session, I encourage you to maybe explore other options. The second characteristic is the personality of the therapist. So you may want someone who's warm and inviting and nurturing, or you may need someone to call you on your stuff, and you'll need someone a little bit more directive in their approach. The third characteristic is location. So ideally you would like to pick someone who is either close to your home or close to your work so that you can more consistently attend sessions and therefore get the most out of your therapy. I will tell you, the more consistently you can attend sessions, the more progress you will make at a quicker rate. So this is important. The fourth characteristic is the theoretical orientation of the therapist. Now this may seem like a bunch of mumbo jumbo to you, which it may, but what it really means is just how does the therapist conceptualize what you're going through, and therefore then how do they intervene with helping you with that problem. So you should be able to ask your therapist, what is your theoretical orientation, and they should be able to tell you a little bit about how they work and how they approach therapy. It's just really the lens in which they see problems through. An example of a theoretical orientation is focusing more on how our early relationships affect your current relationships and your current presenting problems. Another approach is working more on your thought patterns and how your thought patterns influence your emotional state. And another one, for example, is someone who may be more skilled in mindfulness and relaxation strategies to help you reduce your stress, manage it better, and manage anxiety. Those are just a few of the many different theoretical orientations, so it's important to have this conversation within the first session or 2 with your potential therapist. And the last characteristic is your qualifications. So you want a therapist who, based on what you're experiencing, is qualified to treat that. Now that could be education, whether they need a master's or a doctorate level, but it also is important who they've worked with before, that they have experience, they have training to work with you and what you're going through. So these are important things to ask your therapist, and they usually be in your disclosure or informed consent documents as well. You can also check out my website on the FAQ section for a special piece on different education levels of therapists in Colorado, and that gives you an informed approach when having that discussion. Thank you very much for listening today about how to choose a therapist that's right for you. I really encourage you to just ask questions, go with your gut, trust your gut, and try one out until you figure out the best one that's the right fit for you.